Greetings and welcome to Class 2, Module 3 of Psychopathology and Family Systems. In this series of slides, we're going to focus on the importance of context and culture in diagnosing. I've alluded to this, talked about this throughout. This is an ongoing topic, so let's be specific and direct in this particular area. For many people in the United States, there is a stigma that gets attached to having a diagnosis. If you are a person of color, mental illness sometimes acts as an additional burden to ethnic identity. While we might like to think that diagnosing is objective, the research says otherwise and says that this is not the case. In the study conducted by Hama True et al., it was found that despite providers receiving the same criteria and client details, diagnosing was differentially assigned based on race. And so, in other words, for people of color, there was an overdiagnosis of more harsh diagnoses, in particular schizophrenia. When we have this overdiagnosis, it leads to unnecessary hospitalizations, it leads to overuse of heavy medications, and even the use of restraints when those individuals who feel that they are being wrongly diagnosed make attempts to resist incorrect labeling, diagnosing, and hospitalization. When there is an actual matter at hand, at other times, there may even be undertreatment. So equally sad and erroneous is a long-standing perspective that BIPOC individuals have a higher pain threshold. This means that people of color are allowed to suffer longer with pain before onset and care might be rendered that could easily remedy the discomfort. Interestingly, this is the case both in the medical field as well as the field of mental health. Important for us to take in is that variables such as gender, race, and class contribute to both the minimizing as well as the overpathologizing of mental illness. Some ethnic groups, as a function of group membership, are thought to be more disturbed than other groups, even without supporting evidence. What does this mean for us as clinicians? It means that if we rely solely on clinical judgment without the use of other assessment aids, we risk misdiagnosing, and we don't want to do that. When I talked to you in the last series about the clinical interview, I encouraged the use of assessment because we know that gender, race, and class contribute to the minimizing and overpathologizing. We don't want to assume that we won't fall prey to that as well. Now let's talk a bit about family so that we expand your understanding of how family may look and function differently across cultures. So what is family? What constitutes an understanding of family? Universally, family fulfills certain general needs, affective needs of its members. The focus of family is also on having and raising children. This latter aspect, though, the one of child rearing, may be more or less important depending on culture. Suffice it to say, most research and the respective constructs about family are based largely on the white majority culture. This means that constructs around family may be less accurate in defining what family is, how it operates, what is considered to be typical and normal. Finally, to reiterate a point that I made previously, culture offers meaning to behavior, and culture may dictate how emotion and behavior are expressed. Through cultural understanding, behaviors can be constructed, deconstructed, and reconstructed. Culture helps with understanding role definition, interpersonal exchanges, and even worldview. This means that when we are thinking about how we want to assess the person in front of us in relation to their family members, or how we want to make an assessment of a family, we can't divorce that from culture. And we realize that the literature may give us a snapshot of family that is very limited. Acculturation and adaptation to Western values has to be considered. The U.S. culture values individuality, it values self-satisfaction, but opposite of that, ethnic minority families tend to be more collectivistic in nature, giving thought to what is good for the whole, right? So notions about patriarchy in some ethnic minority cultures might be viewed as potentially oppressive from a Western vantage point. Again, these considerations are necessary when diagnosing. So keep those at the forefront as you're listening to the family and trying to give meaning to what it is you're hearing. In the field of psychology, we gauge emotions and we take meaning from emotional expression. In fact, emotion and emotional expression is one of the primary aspects that we use in diagnosing. However, how emotion is expressed may differ given culture and ethnicity. Some cultures and ethnic groups are more comfortable expressing different emotions than are others. So, when we consider the dominant culture here in the United States, emotional expression, I would say, is expected. It's even encouraged. Say what you feel. You have the right to speech and so forth. However, that there is not necessarily that same freedom afforded with every cultural group, even in the U.S., and there is not that same freedom to express to the same degree. Emotional expression for some ethnic groups is viewed harshly and judged negatively. So, for instance, some African American women may be uneasy about acknowledging anger, let's say, because of the pejorative stereotype of the angry Black woman. So, even when the situation calls for an angry response, the emotion may be muted or even swallowed altogether. Again, when thinking about gauging emotional expression, pause is encouraged, particularly when completing the mental status exam.